our provider orders and the one-pager. Alright, so today I'm going to be giving ketorolac for my medication. So I would look at the kidney values, so BUN and creatinine. And those levels are normal today, so I'm able to give ketorolac. I would make sure my client's in a comfortable position. I would ask 3 questions for each of the meds that I could be given today. For flu zone, I would ask if they're allergic to eggs or have been exposed to the flu recently. Ketorolac, I would ask if they're in any pain and when the last time they've had it. And morphine sulfate, I would also ask if they're in any pain and when the last time they've had it. I would do a pain assessment, asking them if they can rate their pain on a scale of 0 to 10. I would say the 3 sites an IM injection can be given: the deltoid acromion process, the vastus lataris greater trochanter, lateral femoral condyle, ventral lateral greater trochanter, the anterior superior iliac crest, and then the iliac spine. I would withhold any medication based on nursing judgment. I will compare my MAR and my provider order and make sure everything looks the same. I have ketorolac for Joseph Smith, Toradol 30 mg IM every 6 hours, PRN for moderate to severe pain. This has not been given yet today, so I'm able to give Joseph this medication. Then I would put the provider order away and only have the MAR out. I would gather my necessary equipment that I need, which I have it all on the table. I would check the integrity of everything I'm using today. It would be closed today. It's open for practicing purposes. Integrity's good. Today I'm using a 22 gauge 1.5 inch for the needle. I would ask my patient if they have a preference on what hip. Today we're going to be doing the right hip for the vastus lataris greater trochanter, and make sure they are able to get this injection, which they are because it has not been given yet today. So now I'll go on to my first med check. So I'm just going to open the drawer and get everything out. Here. I would show my instructor to make sure it's the correct medication. I will go on with my first med check. So I have ketorolac Toradol for Joseph Smith, 30 mg IM every 6 hours, PRN for moderate to severe pain. Good, and it has not been given yet today. That's for Joe Smith, and if it was a single dose vial, I would check the expiration date. If it was a multi-dose vial, I would check the expiration date and the date open. It can only be open for 28 days. If it was my first time opening a multi-dose vial, I would label it with my initials, date, and time. I would check the integrity and make sure nothing is floating or abnormal in the vial as well. Now I will go on to my second medication check. So I have ketorolac Toradol for Joseph Smith, 30 mg IM every 6 hours, PRN for moderate to severe pain. I would again, if it was a single dose vial, I would check the expiration date. If it was a multi-dose vial, I would check the expiration date and the date opened. It can only be open for 28 days. If it was my first time opening the multi-dose vial, I would label it with my initials, date, and time. I would check the integrity of the vial and make sure nothing is floating inside of the vial. Okay, so now I'm going to do the third med check at bedside. I'm going to enter the room. Hi, my name is Jenna. I'm your nursing student. Can you please verify your name and date of birth? I would look at the wristband and make sure it's correct. I would do hand hygiene, provide privacy. Do you have any allergies? I would look at the allergy band. Today your provider ordered we do a ketorolac injection. So that just entails me telling you a little bit about the medication, telling you why it's used, having you teach back, and then giving you the injection. Today for PPE, I need normal gloves. So I'm gonna put those on now. Do you have any concerns before we begin? All right, so first I'm just going to scan your wristband and the medication. And then I'm gonna do the third check at bedside. The patient has the right, I'm gonna open all my stuff in front of the patient. The patient has the right to refuse and has the right to know what they're being given. So now the third med check. I have ketorolac Toradol for Joseph Smith, 30 milligram IM every 6 hours, PRN for moderate to severe pain. Today I'm going to be giving 1 ml per practice purposes. Today we are doing the vastus lataris greater trochanter, which is in your hip. We are doing this because it's the best absorption spot for this medication. So that's that. And then next I'm going to grab my 1-pager. So I'm going to tell you the action of the med. It's an anti-inflammatory used to treat mild to moderate pain. It just reduces your inflammation. Some side effects are dizziness and drowsiness. Then I'll have you teach that back to me. And then, do you have any concerns before we begin? Perfect. Okay. So now I'm just going to get everything ready. So first I'm gonna pop my lid off and clean for 30 seconds in a circular motion. And then next, keeping it sterile, I'm just gonna take that off, put this on. I am going to draw back my medication for air, and then I will take this off, stick it inside the vial, push the air inside, and then I will draw back 1 milliliter with no air bubbles present. I would show my instructor to make sure I have the correct dose, and then I will take that off. I will do the 1 scoop method. Good, and then take that off and put it back in this. Okay, so I taught you about the medication, asked if you had any concerns. Now I will place the client in a comfortable position so they can relax, find the greater trochanter, and then I will pull the skin taut. So I will pull back on the skin, and then I'm going to cleanse the site for 30 seconds in a circular motion. Keep that above where I clean, let it dry for 30 seconds. And then I'm just gonna pop this off. One hand, and I will hold like a dart. Once it's dry, insert at a 90-degree angle while I'm pulling the skin taut. Insert 90-degree angle. I will inject the medication slowly, about 10 seconds per milliliter. And we're doing the vastus lateralis greater trochanter today. Slowly, I will let it sit for 10 more seconds. I will take it out slowly. I would do it on a hard surface for the safety pin. Because of practicing purposes, I'm going to keep it open, and I would put it in a biohazard container. I'm just gonna do the one scoop method for this since I'm keeping it opened. Okay. And then I will document on my MAR my initials, the date and the time it was given. Okay. I will apply 2x2 gauze for pressure. I would assess if a Band-Aid is needed. I will take my gloves off. I documented on my MAR, I would document any norms per agency policy. I would reassess in 10 to 30 minutes. For adverse reactions, if there were adverse reactions in 10 to 30 minutes, when I reassess, I would withhold further doses, contact the provider, contact the pharmacist, take vital signs, and document. I will ask, thank you, do you have any concerns before I go? No? Okay. I would then lower the bed, do the 5 safety measures, lower the bed low and locked, side rail secure, call light within place, bedside table near, room risk-free of falls. I would perform hand hygiene, the 5 stages, before a patient, after a patient, before a procedure, touching patient belongings, coming in contact with bodily fluids. I would cleanse and clean all my equipment and take out the door with me. I will document in OneNote and report any norms per agency policy. If there's anything else I can do for you. Just gonna make sure I got everything. And just make sure I am saying the site, the vastus lateralis greater trochanter. Scan the wristband, scan the medication. Said I could give it because it hasn't been given yet today. Hold the skin taut, get in a relaxed, comfortable position. Okay, you can stop it.